diaphragms here at the top. So we are going to be using 14 by 17 on all of these projections. Okay. Secondly, there are only two centering points you will need to remember, or two heights you should need to remember. Number one, iliac crest. Number two, 2 inches above the iliac crest. Those are the only two locations we will be centering to. We're either going to go directly to the height of the iliac crest, or we will go 2 inches above the iliac crest. Let's see, for demonstration today, you will see everything demonstrated lengthwise. Okay, so all of these will be shown lengthwise. However, I will note that in clinic, you may see that some of these are done crosswise instead. Right, so in lab, you'll be doing everything lengthwise, but in clinic, you may sometimes see your abdomens done crosswise, especially when we do upper abdomen, the high cross. For chest, all our SIDs were 72 inches, correct? For the abdomen, all your SIDs will be at 40 inches. We're going to be working nice and close to your patients.
I'm sorry, we can write in these, right? Okay, because I saw your instructor in competency, so I was like, let me answer your right.
You can write it there.
Okay.
That is yours to do it with as you wish. So 40-inch SID for every single one of these. All right. I think that takes care of most of the initial stuff. Oh, right. Two more things we will talk about. Breathing instructions. For the chest, how did we do our breathing instructions?
Inspiration.
Why did we do our breathing on inspiration?
Get the airfield. Airfield the lungs right here.
Okay, good. So we're trying to fill the lungs with air. We're trying to drop that diaphragm nice and low so we see the lungs at their full size, correct? So inspiration takes those diaphragms and drop it down. When diaphragms go down, they compress the abdomen. So we don't want diaphragms low on our abdominal x-rays. We want the diaphragms up nice and high so we can see the abdomen at its true normal resting state. So what do you think our breathing instructions are? So inspiration or expiration?
Expiration.
Expiration, very good. So breathe in, breathe out, hold it out. Okay,
So breathe in, breathe out.
and then hold it out. Yes. And remember, our goal is to get those diaphragms up as high as we can. So deep breath out. Okay, and then dressing instructions. Right, so for the chest, our dressing instructions for everything from the waist up needs to come off, correct? What do you think the dressing instructions are going to be for the abdomen?
Everything.
Waist up and down.
Everything waist up and down. Okay, so does the shirt have to come off?
Yes.
Do the bras have to come off?
Yes.
Okay, pants,
Yes.
belts,
Yes.
underwear,
Yes.
everything.
Yes.
Just completely naked.
Yeah, that's remember.
That's what we.
So, ideally, yes. In an ideal scenario, you give the patient 2 gowns, one to cover the front, one to cover the back. And you tell them that they need to take everything off. I know it sounds excessive, right? But with the chest, we said shirts can show up, correct?
Mm-hmm.
Okay, If the patient has a bra, those underwires will hang down into the abdominal area. Okay? Pants absolutely have to come off, right? Especially if they have zippers or snaps. And then underwear. Does underwear actually have to come off?
No, elastic.
Right. If you want an optimal image, underwear has to come off because of the elastic. Elastic will show up. You can see elastic on X-ray. And if the patient is bigger, the elastic will compress the soft tissue. So what you'll see on your X-ray is you'll have this white area from all the soft tissue, and suddenly you're gonna have this dark line right here, and then you're gonna have more soft tissue underneath, right? That dark line comes from that fold, where the soft tissue folds in due to the elastic, right? So we do want, if possible, we do want the patient to take everything off when they change. Now, will you see this in clinic?
Yes.
Probably not. You're probably not going to see techs completely have the patient change out. Right? Techs, and right, that is up to the tech's decision, right? That's up to their discretion, how much they want to change the patient out. Right? Depending on the patient, they might just say, all right, lay down on the table, pull your pants down to your knees, drape yourself in this gown, right? As long, right, and then you're like, okay, well, as long as the image looks good enough, then that's acceptable. But of course, here we, especially as students, we don't want to learn good enough. We do want to learn optimal. Right? So the optimal way to do it, the best way to do it, is to have the patient completely change out. All right? Great. So, with that said, we will go ahead and start with our erect abdomen. Okay. So, who would like to be our first volunteer? All right, come on over. So, go ahead and put this on. This is an AP erect, so this is going to go around the front. All right, and back against the board, please. So as you see, we are starting off here at 40 inches. We do have the wall detector selected for our AP erect. Our collimation is 14 by 17. Lengthwise. So, just like with the chest, step one, we are going to find our centering. We need to find the iliac crest. Okay. Now, at least for lab, as far as centering goes, the only abdomens that you're going to be centering for lab exactly at the iliac crest are going to be your AP supine and your PA prone. Those are the only ones that are going to be at the iliac crest. Everything else, we're going to do 2 inches above the iliac crest. Okay, so that should make things pretty easy.
AP supine and
PA prone. Okay, there's some.
Yes, I'm just feeling myself.
So, since this is AP erect, where are we going to center it? Are we centering at the crest or 2 inches above? 2 inches above, good. What is the purpose of centering 2 inches above? What anatomy are we trying to capture?
diaphragm and the pubic
So if you're going 2 inches above, if you're looking at the upper part of the abdomen, right, you're trying to guarantee the diaphragms by centering 2 inches above. Okay, so our goal on the erect abdomen is to capture the diaphragm. If you don't have the diaphragm on your X-ray, you're doing it wrong. Okay, so we need to catch the diaphragm. So let me come over here. So I'm going to come around and I'm going to palpate for the crest. Remember, the crest is not on the front of the patient. If you come over here and you start palpating, and you feel something bony here in the front, that is not the crest. What is that?
ACEs?
ACEs, right? As is the anterior superior iliac spine. Right? That is not the crest. You take that, you follow it all the way up. Crest is going to be up here. Second thing, when you palpate, never go in with your fingertips. You are not going to palpate like this. Right? No creepy crawlies. Right? You're not going to palpate like this. You're going to use the side of your fingers. Right? You're going to cup like this to do your palpation. Right? So I don't want you to come over here and start going like, all right, where is that iliac crest? Right? Don't go in with your fingertips. Okay? You're going to come in from the side like this. All right. So we're going to find the iliac crest this way. Okay. And I think we have our iliac crest right there. So if this is our iliac crest, we're going to center 2 inches above. Remember, for me, 2 inches is about 3 fingers. So I'm going to come here, go 3 inches above, and so this is going to be my centering. This is how high I want to center. Oh, I think I'm already here. Hey, oh, that's pretty lucky. I'll just drop this down a bit just to make it look like I'm doing something. All right, so I am now 2 inches above the iliac crest. Okay, anytime I move my tube, right, I need to make sure to move my bucky to match. Now that I am at the iliac crest, I now need to do my left to right centering, right? Just like with the chest. Once again, I am going to be looking for MSP. Okay, so right now, if I stand right here and I take a look at my patient, I can see that I have light all the way to the left side, but I have shadow on the right side. Do you see that? I have light here, but I have shadow over here. So that's a very obvious sign that I am not centered. If I was centered, it should look even on both sides. So I'm going to have you slide just a tiny bit towards me. Very good.
Right, so, right on both sides.
Well, let's take a look. How does that look now? So you take a look here. What do you see right here on the edge of your body?
The shadow.
Tiny bit of shadow, right? How about on this end? What do you see on the right side?
Shadow.
Also a tiny bit of shadow, right? Mm-hmm. So, assuming that I did this correctly, okay, great. The shadow looks about even on both sides. That way I know I am now centered. Okay, so same amount of light, same amount of shadow on both sides of the body. Okay, with the arms, do not let the patient have the arms like this, with the elbow digging into the soft tissue, right? Because if you do this, guess what you're going to be shooting a picture of? An elbow, an arm, exactly. So you're going to have the patient just slightly move that arm away from the body. Right? It doesn't have to be anything crazy, right? Just slightly away. Good. So just like that is enough. Right? Just move it a little bit out of the way so that you put some space between the abdomen and the arms. Okay. As you can see, we don't really have much room to collimate here. I am catching left to right, with not much wiggle room remaining. So I'm not gonna collimate horizontally. Vertically, notice how the top of the light is at about the level of the axilla. If you have light up to the axilla, you are pretty much guaranteed to catch the diaphragm. So I'm not really going to be collimating vertically too much either. I'm going to leave it like this at 14 by 17.
And that was to collimate to at least the axilla?
So yes,
Okay.
if you have light to the axilla, you're guaranteed to have the diaphragm. If the light's lower, you still may get the diaphragm, but the lower you get, the more iffy it becomes. Okay, finally, marker. Which marker will I use for this one? Does it matter? Alright, you're right, it doesn't really matter, but left side's closest to me, so in this case, I'm going to use the left marker. Okay, if you come over here to the side, and I turn on the light, you will notice there is no light on the IR. So where on earth do I put this marker?
Maybe
can't come out
right
right.
here. Over the space.
There's no light on the. There's
Sorry, I
no
couldn't see.
light.
At the bottom?
Bottom corner?
Yeah. So I'm confused if it's this.
Okay, so we do need to put the marker somewhere, correct? We can't just leave it off because there's no light. So take a look at the anatomy covered right here. What anatomy would you expect here in this corner?
Opposite liver, small side of the liver.
So
it's way up
right
there.
here, right up
heart,
here.
Heart, probably.
Okay, heart. What other anatomy?
Lungs. Some
Lungs.
Yeah.
Okay, great. Heart and lungs would be up here in this top corner. So what part of the body is that considered, heart and lungs?
Respiratory.
Okay, but more generally speaking, chest.
Oh.
Right? All right. Down here in this corner, right here, what kind of organs would you expect?
Intestine.
Mhm.
The large intestine.
Okay, intestines. Okay, what else? Maybe?
Kidney?
Okay, ovaries, kidneys, great. So what kind of anatomy is this?
Pelvic.
Abdominal. That's what I'm looking for.
Yeah.
Abdominal, right? Because we're talking about things like in the intestines. So, top corner, chest. Bottom corner, abdomen. If I had to cover one of those two with my marker, which one do you think I would cover?
Thoracic.
Why would I cover up the chest stuff?
Because you're not looking for that.
Yeah, you're looking
It's
for
not
that.
the
Right.
space of interest.
Yeah.
Good. This is an abdomen exam. I am not looking for the chest. So, if I have no choice, right, if there is no light for me to put my marker, I am going to put my marker where it is going to cover anatomy that is not in the area of interest. In this case, I'm going to put it up top here in the topmost corner where I know it's going to be lungs and heart, right? Stuff that's not abdomen. Okay, so now that we've done that, we've done our, right, so we've done our centering, our positioning, our collimation, our marker, our shielding. What's left?
Breathing.
Right, breathing instructions. So what did I say the breathing instructions were earlier?
Inspiration.
Okay, expiration. So, Sindhu, take a deep breath in. Blow it all the way out, all the way out. Hold it out. Don't breathe, don't move, don't breathe. X-ray. You can breathe, you can relax. Okay? So, all the way out, and then X-ray. Now, back against the board, I want to point out one final thing. So, when I hit this light, what do you notice is at the bottom of the light?
The shield.
The shield. So I am missing the entire bottom of her abdomen on this x-ray, correct?
Yes.
Is that acceptable? No, right? I don't want to be missing that anatomy. So, should I be shielded? In this case, I should not shield. Right? You shield unless the shield covers anatomy of interest, in which case you can't shield. In this case, my anatomy of interest is the abdomen. If I shield like I did on my chest, I'm going to cover that anatomy. So, realistically speaking, I would actually want to take the shield off. So, right. Now, earlier, I also mentioned that sometimes we can do abdomens crosswise, correct? Okay, so instead of doing it lengthwise like this, when you do upper abdomens, right, when you're trying to catch the diaphragm, you may be asked to do a high cross. High meaning upper abdomen, right? Because it's high up. Cross meaning crosswise. So instead of this, you may sometimes see okay, and then from this, I'm just going to slide it slightly up to compensate. Slide towards me just a tiny bit. Okay, thumbs up. Good. You may sometimes see this. This is